Watch how we take this foot and transform it to this in this next video. So for today's video, I'm going to go through a case study that's really interesting. A lady came to me about a year ago. She was very emotional, very self-conscious of her foot. As you can see by the picture here, her lesser toes are going outward. She has a very large bunion. She came to me just in tears with just the emotional burden that it's caused her. Aside from the emotional burden though, physical pain too. She has to wear men's wide shoes, as you can see, with the foot looking wide, with the toes going to the outside and the big bunion. It's really hard to find shoes that really accommodate her. So she came to me asking for advice and help. She had seen other doctors in the area, and the other doctors had talked to her about doing really extensive reconstruction that would keep her off her foot for almost 3 months. She'd be in a cast for 3 months, and it really scared her. And she had family members and friends that had undergone foot surgery, and they had a lot of horror stories for her. She learned about me, and she learned that I do minimally invasive foot and ankle surgery, and so she came to me for a consultation. We originally started with fixing her bunion, and so I fixed her bunion in a minimally invasive way. It turned out really great. She was very happy with the results. And then the second step was to reconstruct the toes through a minimally invasive approach. And so as you can see, here is the finished product right here, and here's the before. Huge transformation for this lady. What's amazing about this procedure is that the incision sizes were less than a dot. They are so small that I didn't use sutures to close the skin for her, and she has a very aesthetically pleasing foot now. Aside from the toes looking normal, there's no scar on the foot really, as you can see, and that was really the selling point for her. Kind of coming back to the minimally invasive approach, as you guys have seen in my other videos, she was amazed with how little pain she was in. A lot of patients come to me in fear because they are afraid of large incisions, but they are also really afraid of the pain that can be caused by foot and ankle surgery. There are a lot of nerves in the foot, and these nerves can get disrupted with traditional open surgery. Not to say they can't get disrupted and that they can't get injured with minimally invasive surgery. It's just that the likelihood is less. You know, we are able to respect the soft tissue structures way better, and we are able to prevent these injuries that we hear about with open traditional surgery. But the big thing I would like you to take away from this video is, you know, the traditional incision, as you can see here, this is the traditional incision, and you've seen this picture in my other videos. You can see the long incisions. If we were to have used this approach on this lady, she would have long incisions on all 4 of these toes here, the bunion, and then on the second, third, and fourth digit as well. And this would have caused a lot of swelling. This could have put her at risk for possible infection, possible blood clot, and she'd have to be off her foot for an extended period of time. And so with this case that we did for her, she was able to walk the same day in a boot. She is since transferred to a normal shoe now. She was in the boot for 2 weeks, followed by a post-operative shoe, which is just a sandal, for just a week actually. And I actually got her back in her tennis shoe by week 4, which is actually incredible. And just to see how happy she is now, I'm going to actually have her do a patient testimonial because she is so happy with her results thus far. Just to kind of recap, this lady, she had sought advice from other people. As you can see, the foot before the surgery looks completely different from what it looks like now, as you can see it. She even mentioned that her kids would poke fun at her, and it really made her self-conscious. They would say that she has this peace sign, kind of like this, in between her big toe and her second toe. Well, she doesn't have a peace sign anymore. She has a normal looking foot, and if someone were to look at her foot today, they wouldn't be able to tell that she even had surgery done. She is, again, ecstatic, and again, I'm going to have her on the channel here very soon with a patient testimonial. But you know, this is what I do. I do minimally invasive foot and ankle surgery. As I mentioned before, I take a cosmetic approach to all this. Yes, scars shouldn't be a big deal, but they are. Patients don't like scars. If I am able to reconstruct your foot like this lady's without any scarring, minimal pain, you're able to get back on your feet, why not? And that's why I love this technique so much, minimally invasive foot and ankle surgery. If you're new to the channel, please go back to my original video on what is minimally invasive surgery, and I go into great detail on what we can fix. This is just one example of what we can do with minimally invasive foot and ankle surgery. If you are somebody that is suffering from a foot and ankle condition and you are interested in learning more about minimally invasive surgery, please reach out to me. I'd love to discuss with you and help you with your issues. And if I can't be of any help, perhaps we can find you a minimally invasive surgeon in your area, somebody that can help you get back on your feet and be confident in yourself. That's all for today's video, guys. I wish you a Happy New Year, a Merry Christmas, and please like and subscribe, comment below. I do have a TikTok platform. I'm on Instagram, on Facebook. Please follow me on all 3 platforms. I'm doing my best to publish videos every single week. Sometimes it gets just a little crazy, but my goal for this channel is to really promote minimally invasive foot and ankle surgery. Just another way of fixing people's ailments with minimal risk, minimal downtime, minimal pain, minimal swelling, and of course, make your feet look pretty. I'm out, guys. Take care.